Hello and welcome to this video on a new age cult and alternative medicine fad called total plasma replacement. Before going to the depths of this quackery, we should clearly point out that this total plasma replacement and not plasmapheresis. The latter is where you receive plasma that has been cleaned, such as with dialysis, in very broad terms. By contrast, a total plasma replacement is as the name suggests. Your plasma is taken out in full normally, as whole blood, and the red blood cells and a replacement solution, such as plasma, is infused back into your body with said red blood cells. It's essentially substituting plasma with something more inert. We take issue with a total plasma replacement for its quackery use and not plasmapheresis or apheresis. Just bear that in mind as we work our way through this video. Total plasma replacement is often compared to dialysis, and for some good reasons. As with dialysis, the process takes your whole blood, which is a combination of red blood cells, leukocytes or immune cells, platelets, blood proteins, salts or electrolytes, sugars, and so on. The process first separates out large things like red blood cells and puts them back into your body. These are relatively important, and therefore getting rid of them is a bad idea. The next step separates anything small, like salt, and takes them away, and then progressively larger things like protein, and then finally larger things again like leukocytes. This removes almost all the plasma-based content of your blood and replaces it with something on par, or at least functionally similar to saline. Unlike dialysis, where the leukocytes, platelets, proteins, and so on are returned, this is not the case in total plasma replacement. In fact, very little, if anything, is returned to your body other than red blood cells. So far it sounds questionable, and it really is. Even the Jehovah's Witness Church argues it is a bad idea, but they have issues with any kind of life-saving hematology-related medicine, so their self-deletion fetish is maybe not the best support for our argument. This raises the question of what is it used for, and why? If we take the alternative medicine quack's claims at face value, then it removes harmful substances, reduces inflammation, improves your health, and reduces symptoms of disease, modulates your immune system, prevents disease progression, and restores function of organs and tissues. In short, alternative health quackery buzzwords sell it. We'll address these mostly point by point, but very simply and to the, point. First, your kidneys and liver would already be removing the harmful substances other than the rather notable amounts of money that this procedure costs, and most people do not view cash as a harmful substance when it is either in their wallet or bank account. So no, this isn't helping by removing anything harmful. For the most part. There's also reduction of inflammation, which is nonsense. Yes, you might remove circulating pro-inflammatory markers, but not the already initiated processes from damage. For example, if you have hepatitis or inflammation of the liver, you're not going to stop that by removing all your plasma. Damage like suddenly draining the body of all kinds of plasma content can cause an acute shortage of all kinds of things the body needs, and in fact exacerbate exactly what you're trying to stop. Improvement in disease symptoms is just laughable, but this is like saying that being bled is good for you. Actually, this does sound a lot like the 18th and 19th century practice of bleeding people, only we've yet to see any claims that it prevents spontaneous combustion, but we will not be surprised. It does, however, sound a lot like they're practicing the four humours, so perhaps somebody finds this funny. There is no way for the total replacement of plasma to help with pain, for example. This is yet another claim made, and it's because pain is a neurological phenomenon. The only way it is possible is that in the process of replacing the plasma, the practitioner caused some sort of neurological damage and thereby prevented you from feeling pain, which is typically considered medical malpractice, not an actual intended effect. It claims that it can modulate leukocytes, or your immune system in general, are just silly. T cells, and particularly T killer cells, are modulated through natural killer cells and the thymus. Together, these two prevent certain cells from behaving improperly when the body can actually do something about it. The B cells are the same, except they respond through being stimulated by the immune system and specific antibodies. You're not going to change anything by removing them. Note that you are literally taking away a vast quantity of the leukocytes that make the immune system work. By having total plasma replacement, you are making the immune system work less well, not better. There is no way to stop the progress of a disease through total plasma replacement. For example, if you have asthma, the hyperallergic reaction from exposure to an allergen will not be improved or stopped with this therapy, as it is based on a reaction from mast cells in your lungs, and you've not removed these cells. Further, cancer won't be stopped or slowed down except when they inadvertently poke the cannula into a cancerous growth, in which case you have bigger concerns. And any other condition is basically the same thing. Finally, we have claims that it will restore normal function. This claim is like saying that if your car engine is broken because a piston is blown, the radiator has a leak, the alternator has died, and the timing belt is wonky, replacing the engine oil will fix everything. In fact, the opposite is likely to be true. Suddenly changing blood volume this way can cause all kinds of issues with the renal system, as its key role is modulating blood volume. And if your kidneys, for example, are already in poor condition due to, say, renal failure, you have bigger issues being caused by doing this. And it's true of just about every other kind of, let's say, abnormal tissue function or organ function. It won't solve diabetes, for instance. It won't help with MS. It won't help with a lot of things, broadly speaking. We have been critical of this procedure so far, and we've been critical for very good reason. Most of the time it is sold as a stupid panacea that only solves the issue of separating gullible idiots from their hard-earned money. That criticism is not entirely well-founded. Total plasma replacement does have medical uses that are justified, but to be very clear about this, they are very specific and they are actually evidence-based. It's not like you can just pull out a random disease from a hat and say, total plasma replacement will fix this. So, total plasma replacement is used to treat certain kinds of blood, nervous system, and autoimmune diseases, and those are the three primary categories. You have things like thrombotic thrombocytopenia purpura, Guillain-Barré syndrome, multiple sclerosis, although not all kinds, chronic inflammatory demyelinating polyradical neuropathy, Lambert-Eaton syndrome, myasthenia gravis, certain autoimmune diseases related to the kidneys, such as Goodpasture syndrome, Waldenstrom macroglobulinemia, and a few other things again, but this sort of covers the major common examples. The difference between these conditions and what alternative medicine quacks claim is that actual medicine has an understanding of the mechanism that underlie the specific function of how total plasma replacement will help with this and what's actually going on versus claims of a cure-all by snake oil salesmen. For example, we have thrombotic thrombocytopenia purpura. This is a clotting disorder, and you are literally removing the platelets that lead to the blood clotting. You can't have a blood clot if there is nothing to clot. This does, however, have certain issues associated with it, for example, bleeding out due to a lack of blood clots. Guillain-Barré syndrome, MS, chronic inflammatory demyelinating polyradical neuropathy, and similar autoimmune diseases are affected because you are removing the leukocytes that cause the disease directly, or at least drastically reducing their population, and thereby reducing the severity of the condition. Now, we don't bring this up as a treatment very often for very good reason. Total plasma replacement is used sparingly and only for certain conditions, or should only be used for certain conditions, because it is not without risk. Now, the very obvious risk is going to be things like low blood pressure, which, depending on your particular, let's say, comorbidities or other personal issues, particularly medical issues, may or may not be a significant factor. As we mentioned already, something like a renal failure or kidney disease is a very significant risk factor when you talk about low blood pressure. But same thing with certain heart conditions. And then you have, say, shortness of breath, which, again, due to issues around the way you're handling blood in the body, if you are short on red blood cells for even a short period of time, a shortness of breath becomes a shortness of oxygen full stop. A metabolic alkalosis is another one. A bleeding, again, due to that whole you don't have any platelets to speak of. You have an increased risk of infection, initially because you've put a hole in somebody and that hole penetrates through the first and most immediate protection. But secondary to that is that even if something gets past that, you have no internal defenses anymore because you've taken away most of the leukocytes and antibodies that were in your blood, and specifically within your plasma. You can affect the amount of calcium in your body, particularly because that's one of the things present in your plasma. You can affect other electrolytes and similar, such as potassium, leading to hyperalkalemia, and if you're not using a plasma replacement fluid, for example, if you've just been given plain saline, you're in for a very bad time. And finally, one of the more, let's say, common options is for somebody to go along and find a donor of sorts. and take their plasma and have it put inside of them. Now, under differing circumstances, this can be good or can be bad. In a hospital setting where you're getting plasma to make up blood volume, it's fine, because the hospital will go through very rigorous steps and very strictly monitor to ensure you get the right match. Any cowboy or cowgirl who decides that they're going to do this in their backyard, in their caravan, or a pop-up shop in the shopping centre isn't likely to be performing those kinds of rigorous tests, and so you're likely to get an autoimmune response, some sort of allergic reaction. And so you can have anything from as mild as breaking out into a rash through to anaphylaxis and then death. And so, yeah, it's one of those things where hospitals are where you want to be having this done, if it's done at all, and not your local health practitioner who thinks that having done their online course, they know how to provide you with the best healthcare. This is why total plasma replacement is a quackery procedure in most, if not all, common occasions and applications. The exceptions are where it has specific applications, and understand that is a big distinction here. Most alternative medicine will sell it as a cure-all, whereas most medicine will have it as a specific treatment for a specific condition. Because medicine understands the cause, mechanism, and effect of intervening in removing a large, if not the entire proportion, of the blood plasma. It's not just done in the general intention of, you'll get better somehow. Good intentions and wishful thinking are not a way to treat people. Actual medicine treats people. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. And please do post any comments, questions, or suggestions that you have